Good morning, everybody. Good morning. So, welcome to those of you who are on the webinar. For those of you on the webinar, you may not have the sense that we have such an intimate setting here today for our workshop, and we have people filing in because of the fact that there's so many activities going on here at the National Academies building, and there's a line to get in. So we apologize for starting a few minutes late. I'm Dr. George Isham. I'm co-chair of the Roundtable on Population Health Improvement, a task I share with Dr. Sandy Magnan, who you'll see later in the agenda. We both want to extend a warm welcome to all of you for this workshop on a very important topic. So I am particularly appreciative of the fact that we have some very distinguished and esteemed speakers who've taken the time not only to be here with us, but to prepare, to participate, and help make this a lively and important conversation. So it's very important. I've already mentioned the fact that there's a webinar audience out there, but I want to make sure everybody is aware that this event is being recorded and webcast, and that the recording and the webcast will be available on the website, on our Roundtable website afterwards. So if you have any concerns about any kinds of behaviors you might exhibit or things you might say, please remember that this is a recorded and public conversation. We will attempt to take questions and comments from the virtual audience out there by web. I think there's a mechanism that you'll be made aware of for doing that as time permits. So we'll hopefully be able to do that and include you in this conversation. Excuse me. Since February of 2013, Roundtable has been providing a trusted venue for leaders from the public and private sectors to meet together and discuss the leverage points and opportunities arising from changes in the social and political environment for achieving population health. The Roundtable's vision is of a strong, healthful, and productive society which cultivates human capital and equal opportunity. The vision rests on our recognition that outcomes such as improved life expectancy, quality of life, and health for all are shaped by interdependent social, economic, environmental, genetic, behavioral, and healthcare factors, and will require a robust and community-based policies, robust national and community-based policies and dependable resources to achieve it. Keep in mind that phrase, dependable resources, because it is the core of today's gathering. As we have, over the course of the Roundtable, thought about our very ambitious vision, which I've just read to you, we've thought about the various categories of levers or areas in which actions might be taken that might get us closer to achieving that vision. And the six that we have focused on in the past are relationships, building dependable relationships, policy, having effective policies at the national, local, and private level, measures in terms of knowing where we are and how we're doing, effective communication policies, obviously research in terms of helping us understand the relationships, but also the potential interventions that might change our society so it's more healthful. And then lastly, resources. And of course, resources are key in terms of our current situation in the United States, because there is a distortion or a misallocation, in my opinion, of the resource allocations as if the desired outcome is a healthful and equitable society. So with that starting point, we still need to kind of deconstruct the issues and the topics. There's nothing in healthcare I've come to realize that's simple or straightforward. It's always complex. And so this is a knotty and thorny kind of issue that's particularly appropriate for the Roundtable to begin to unwind, deconstruct, and understand, with the notion in mind that we'll create conversations as a roundtable for different of the many stakeholders that must take action to improve health to use in terms of formulating those approaches that move us closer to that healthful and productive society. So, as one of our major activities, we sponsor workshops, and this is one of them, for members, stakeholders, and the public to discuss issues of importance to improving our nation's health and these topics. And in the past, we've covered such topics as pay for success, financing, and community benefit programming. And today's workshop, as I've already hinted at, is focused on building sustainable financing structures to support improving health, wealth, education, well-being, and health equity. The importance of this, I think, is underscored by one of the conversations we had in our previous workshop we had on health and its relationship to education, where Peter Orszag talked about the competition of resources and gave us the example of how over the course of my life, over the last number of decades, the quality of public higher education has been affected relative to the quality of private higher education in the country. And so that kind of rationale from an important source is really important to pay attention to in terms of embarking on this journey of understanding assets and resources allocations. But it's not often you have a personal anecdote which brings you close to the dynamics. And as some of you know, I have the opportunity to serve on not-for-profit healthcare boards of directors. And in one session with our community board members, the head of the community college system in a state was talking about the fact that in the budget shortfalls that the state had experienced, the competition of funding for community college assets in that state were falling into a situation where resources would be cut relative to the demand for Medicaid funding, which is already not robustly funded in that state. And so you see the dynamics up close of the kind of day-to-day kind of interactions that produce the current allocation of funding, and you begin to realize that if education is important to health, that we need to understand and address them in a more robust way. So let's get on to it. Let's actually get to the people that know something about this and the and the agenda. So if you're tweeting, please use the hashtag Population Health RT as noted in the bottom of the agenda and on your materials. If you have any logistical questions during the course of the day unfold, please talk to one of the staff at the registration table or here in the room, and there are several. Note that the meeting materials may include slide sets given to the staff in advance, but other materials that have been more recently provided will be available on our website and our web page, and that will be an opportunity for you to examine those if you wish in additional detail at your leisure after the conference. As we begin the day, I would like to particularly express my appreciation and thanks on behalf of the Roundtable to the Planning Committee for today, and especially for Pamela Russo, who's provided leadership to the Planning Committee and has also provided leadership in many other ways to the conversations we've had at the Roundtable. We're particularly grateful for her taking on this task. The Planning Committee was Carter Blakey, Alex Blanford, Denise Fairchild, Gary Gunderson, Jim Nickman, Bobby Milstein, Chris Parker, and I'd like to further say that Pamela Russo is Senior Program Officer at Robert Wood Johnson Foundation and is, as I indicated, a valuable member of the Roundtable on Population Health Improvement. So without further ado, Pamela Russo. Thank you.